Switching topics, it's spring break in about a week, and some might call it the beginning of sunburn season. Dr. Michael Hadley from Ogden Clinic is joining me with a word or two of warning and prevention. Good to have you.
Thanks for having me.
What's the biggest concern that you have when it comes to skincare of the women of Utah?
Well, I think over the years we've getting a lot of data relative to the effects of chronic sun damage, both on aging, wrinkling, and most importantly, skin cancer. So as the weather warms and we shed the clothes and we go outside, like Utahns love to be outside, we bring into play the possibility of sunburns and the long-term effects, which include aging, wrinkling, skin cancer.
We've known for a while those concerns and those risks, but the data, like you said, continues to pour in. So what do we know about what actually happens to the skin when those sun rays take their damaging effects?
Great question. So I think the myth out there is that a tan may help us in terms of prevention of skin cancer, but there is no safe tan. Increasingly, tanning booths have been shown very strongly to increase your risk for melanoma. In fact, recent studies have shown that getting into a tanning booth will increase your risk by 75%. As Utahns, that's the last thing we want to have.
Can you reverse sun damage?
Good question. Probably the best thing we can do going forward is to prevent the effects with good sunscreen use. But there are some topical things that can be used, creams, whatnot. Seeing a board-certified dermatologist, they can kind of work through those issues. And there are a variety of things that actually can be done, whether it be creams, lasers, or other preventative measures that can be helpful. You
mentioned the prevention, so I'll ask, what is a sunscreen you recommend? What ingredients should we be looking for?
You should be looking for a broad spectrum. Ideally, we like physical blockers, those that have zinc oxide or titanium dioxide. Those are the best sunscreens. I think the myth out there is titanium or zinc go on very white. But nowadays, they've tinted them, they've micronized them, so they're very elegant and they can match your skin tone, and you'll hardly know you have anything on.
You're encouraging everyone to get a skin check. What does that entail? What does that appointment look like?
Good question. Yeah, the recommendations are once a year, visit your dermatologist, have these moles and other growths that you may be unaware of looked at by your dermatologist. Oftentimes, they can pick up on things that you may not be aware of that oftentimes are benign, but sometimes turn out not to be benign. And early intervention is always the best form of treatment.
Where can we make that appointment with you?
I'm located in Bountiful, the Ogden Clinic, and you can go on to theogdenclinic.com and find us.
Great. Dr. Hadley, important information.
Thank you.
Thank you so much.